Let's talk about the types of MS. Now, there are four main types of MS. You've got the clinical isolated syndrome, where basically you have one single episode of MS, which is not enough for a diagnosis because you now have to wait possibly many more years to have another single episode. However, if you have a scan and it shows more than 2 lesions, then it's most likely that you had MS, but just one episode, you'll be classed as having CIS, which is a clinical isolated syndrome. So you have one attack and you might not have another attack for the rest of your life. But in most cases, a CIS would then go on to become what we call relapsing-remitting MS. Now, relapsing-remitting MS is the most common form of MS in 85% of people. You can have a relapse where your symptoms are stable between each relapse, but your symptoms or disability gets worse after each relapse. So for example, it could be that you could walk with a stick, but after the next relapse, you now need to use a wheelchair. But you need to use a wheelchair until your next relapse. So your symptoms don't get worse while using a wheelchair until you have another relapse. And it's also, a relapse is now followed by what we call a partial or full recovery. Some people recover 100%, some people are 90 or 95%, so this is known as remission period. Relapsing-remitting MS can eventually lead to what we call secondary progressive MS, where you do not continue to recover like you previously did after each relapse, and progressively your disability starts to get worse. So what is a relapse? Some people refer to a relapse as having a flare-up or exacerbation or worsening of symptoms. So this is when you might have new symptoms or your existing symptoms appear at least more than 30 days after the last episode or relapse and lasting for more than 24 hours in the absence of any medical cause, such as maybe a fever or an infection, such as a UTI. For example, a UTI can present with pain on passing urine, urgency and frequency, which might be similar to what MS does to your bladder, which again is urine urgency, frequency. So it can be difficult to differentiate between, is this a UTI or is this a relapse of MS? So again, having a relapse affects everyone differently. It can range from mild to severe, where basically symptoms can last from days to weeks to months. So the other type of MS is called primary progressive MS, PPMS. Now this is found in between 10 to 15% of people with MS, where your symptoms actually get worse right from the start, despite not having any relapses or remission. So progressive means that your symptoms are actually progressing towards increasing disability. Now the third type of MS, or the fourth type, is the secondary progressive MS. So most people will start with relapsing-remitting MS, and then over time, despite not having any relapses or remissions, their disability starts to get worse. This can happen gradually or it can happen very quickly. This means that unlike in relapsing-remitting MS, where your symptoms get better, where you have the period of recovery after each relapse, you're no longer having those periods of recovery after each relapse. Now the problem here is that a lot of people are diagnosed as secondary progressive MS right from the start because initially you do not recognize what the symptoms of MS are. Like if you're having numbness or tingling, you're not thinking, oh, I've got MS. And also your doctor is not thinking this could be MS. They could be thinking this could be a vitamin B12 deficiency, folic acid deficiency, or even having that MS hug, which is one of the early sign of chest pain. They're thinking, oh, okay, we've ruled that heart condition, so maybe this is anxiety or musculoskeletal chest pain. So eventually a lot of patients or people end up being diagnosed as having secondary progressive MS right from the start. Now I hope you all enjoyed this video. Please feel free to share, like and subscribe.